Namaste, myself Name-Shivi, Saxena, Faculty of Physiotherapy and Diagnostics, and my discipline is Medical Laboratory Technology. So, welcome to Digital Version 2.0. So, today my topic is Leishmania. So, firstly, start general characteristics of Leishmania. So, the genus Leishmania is named after Sir William Leishman, who discovered the flagellate protozoa causing Kala Azar, the Indian visceral leishmaniasis, that means VL. All members of the genus Leishmania are obligate intracellular parasites that pass their life cycle in two hosts. First, the mammalian host, and second, the insect vector female sandfly. The humans and other mammalian hosts, they multiply within macrophages in which they occur exclusively in the hemistygote form, having an ovoid body containing a nucleus. So, thus, having a void body containing a nucleus and kinetoplast. In the sandfly, they occur in the promastigote form with a spindle-shaped body and a single flagellum arising from anterior end. Leishmaniasis has a immense geographical distribution in the tropics and subtropics of the world, extending through most of the Central and South America, part of North America, Central and Southeast Asia, India, China, and the Mediterranean region and Africa. The disease affects the low uh, socioeconomics group of people and overcrowding, poor ventilation, and collection of organic material inside house facilitate its transmission. And across the tropics, three different diseases are caused by various species of genus Leishmania. They are first Bristol leishmaniasis. The species Leishmania donovani, complex infective internal organ, that means liver, spleen, and bone marrow of human in the positive parasites. And second, cutaneous leishmaniasis. The species Leishmania tropica, complex, and Leishmania anthiospica, and Leishmania major and Leishmania mexicana complex are the positive parasites. And third, mucocutaneous leishmaniasis. It is caused by the Leishmania brasiliensis complex. Okay. So, classification. The genus Leishmania include a number of different varieties and subspecies which differ in several features such as antigenic structure, isoenzymes, and other biochemical characteristics, growth properties, host specificity, and etc. So, Leishmania species can also be classified on the basis of geographical distribution as given that distribution. So the various manifestation of leishmaniasis and leishmania species causing them have been summarized. So old words leishmaniasis. So Leishmania donovani. Leishmania donovani cause visceral leishmaniasis or Kala Azar. It also caused the condition. So post Kala Azar, the dermal leishmaniasis, that means PKDL. History and distribution. So Sir William Leishman in 1900 observed the parasite in the smear of a soldier who died of dum-dum fever or Kala Azar contracted at Dum Dum. Calcutta. Leishman reported this finding from London in 1903. In the same year, Donovan also reported the same parasite in spleen smear of parasite patient from Madras. The name Leishmania donovani was therefore given to these parasites. The MST form of the parasite as seen in smear from patient are called Leishmania donovan that bodies. So, visceral leishmaniasis or calaza is a major public health problem in many parts of the world. According to the World Health Organization, a total of 5 lakh cause of 50,000 cases of visceral leishmaniasis occur every year. Of these new cases, 90% are found in the Indian subcontinent and Sudan and Brazil. The disease occur in endemic and epidemic or sporadic form. Meso-endemic of the disease the currently found in India, Brazil, and Sudan. Okay, so at present, the disease has established its identity is 31 districts in Bihar, 11 districts in West Bengal, 5 districts in Jharkhand, and 3 districts in Uttar Pradesh. So, sporadic cases they have been reported from Tamil Nadu, Maharashtra, Karnataka, and Andhra Pradesh. So, this session is completed, and thank you so much. Any query in mention comments box, and namaste. Namaste, myself Jayoti, Saxena, Faculty of Physiotherapy and Diagnostics, and my discipline is Medical Laboratory Technology. So welcome and Digital Version 2.0. So my today topic is morphology of Leishmania. Firstly, size and shape. The Leishmania occurs in two forms, namely Leishmania and Leptomania. These two forms alternate between a vertebrate and an invertebrate host. These two forms are recognized one on one idea of the position of the endoplast and Reploroplast. Also, the pose taken by the flagellum in vital in identification of the Leishmania form. So, Leishmania form. This type is additionally referred to as the MST form. The dimensions range from 2 micron in to 4 diameter. This type occurs intellectually within the blood cells and therefore the organs of the reticuloendothelial system like liver, spleen, bone marrow, or marrow. This type is microscopic, rounded, or oval with a central nucleus. Eleptroblast and kinetoblast. This type does not have a free flagellum. And leptomonad form. This type is additionally referred to as the promestigote form. Its size range from 15 to 20 long and 1 to 2 micron in length. This type occurs within the midgut of the invertebrate host or sandfly. This type is elongated, slender, and spindle shaped with an outside centrally placed nucleus, fibroblast, and kinetoblast. These form possess a free flagellum. Okay, so Leishmania life cycle. So Leishmania may be a genetic parasite which need two hosts to finish its life cycle. These two parasites are named as primary and secondary hosts. The first host is that the principal host, which may be a vertebrate or man. Within the primary host, the parasite feeds and multiplies itself asexually. On the opposite hand, the secondary host is that the host or vector which is typically an invertebrate or a blood-sucking insect. Within the case of Leishmania, it's sandfly. This sandfly belongs to the Pentomus, and in the life cycle of Leishmania will be also find a reversible host, which may be mammals like dogs, jackals, and ground squirrel. Within the reversible host, the parasite does not undergo any change, rather, it simply waits to seek out its principal host through central. So, symptoms. The incubation period of visceral leishmaniasis is long, starting from 3 to 6 months. And also the symptoms of the fever may appear even after 2 years. The very early symptoms of visceral leishmaniasis include swelling, high fever, enlargement of organ or reticuloendothelial system like spleen and liver. These symptoms are followed by general weakness, anemia, thanks to reduction within the number of blood cells and darkening of the skin. In the advanced stage, the skin of the infected person becomes completely dry, rough, or dark with lot of pigmentation. Hair becomes brittle and fall out. If the patient does not receive proper treatment, it can cause his death in 2 years. Generally, death is thanks of secondary secondary uh, secondary infection by bacteria or virus because the patient become immune compromised. Uh, in other words, the patient would not be ready to resist the infection caused by bacteria, virus, or the other microbes. So, post-Kala Azar dermal leishmaniasis, that means PKDL. So, post-Kala Azar dermal leishmaniasis may be a recognized complications occurring during a very mild form in old 50, about 50% of Kala-Azar cases, and in several forms in few cases, usually skin lesions develop months after the clinical cure of Kala-Azar. But sometimes PKDL occur during treatment or maybe before Kala-Azar. In most of those cases, however, a previous infection occurs subclinically. In some cases, no history of previous Kala-Azar is understood. So, laboratory diagnosis. Before proceeding to any biopsy for primary Kala-Azar, that are rapid diagnostic tests. So first exclude malaria by doing a blood test and and treating is positive or if no testing is possible, simply treat and evaluate after 4 days. If the patient still feature a clinical diagnosis of Kala-Azar, a biopsy should be done. A patient who is severely ill are often tested by for Kala-Azar will at an equivalent time getting treatment upon movement. If the patient has been treated for Kala-Azar before with sodium gluconate diagnosed SSG for 15 days or more and is sick again, they are doing not need need a that test. They will have a replace. Diagnostic technique involve serological and parasitological testing. So serological test. First, rapid diagnostic assay, that means RDT, direct blood test, DAT, parasitological test, first lymph gland aspirate and splenic aspirate and bone marrow aspirate. So treatment, generally two groups of medicine are used for the treatment of visceral leishmaniasis. These include preferential antimony compound like sodium antimony tetrate and sodium antimony glutamine and urea stabilizing amino stabilizer alongside pentamidine isethionate. And so prevention. The properly prevention the prophylactic measure to be taken to stop the disease. The eradication of the insect vector is of primary importance to stay the disease in check. Low trees and bushes should be cleared called at the endemic areas, and periodic fumigation is spraying of the insecticides uh, is additionally advisable of advisable to stop the disease, and reversible hosts like dog, jackals should be kept concerned. Proper treatment campaign may be a good control measure in India. To avoiding the bites of sandfly insect repellent in mosquito net are often used. Also avoiding to sleep on the ground are often beneficial. So this session is completed and any query in mentioned comments was. So thank you so much. Namaste.